So now we're going to talk about heat conservation in the body. How does body conserves heat? Via one method is vasoconstriction. Is caused by a stimulation of posterior hypothalamic center, sympathetic center. You can recall that we talked about this, that cold stimulates posterior hypothalamic sympathetic center, which stimulates the production of heat generation. So you have decreased heat loss via blood from skin surface due to vasoconstriction. What's the mechanism? You have sympathetic nervous system stimulate alpha-1 receptors on the blood vessels. Alpha-1 receptor are linked with GQ protein, and alpha subunit of GQ protein that was bound to GDP at rest now binds GTP when gets stimulated, and alpha GQ subunit dissociates and activates phospholipase C, which converts PIP to IP3 and DAG, diacylglycerol. So IP3 binds endoplasmic reticulum, releases calcium intracellularly, increases cytosolic concentration of calcium. Then you have calcium binds to calmodulin, and this calcium calmodulin complex activates myosin light chain kinase. This MLCK phosphorylates regulatory light chain of myosin, and that's how myosin basically changes the conformation of its head, and calcium and calmodulin along with MLCK kinase activity phosphorylate and stimulates the myosin binding of actin, and they also inhibit caldesmin and calponin, which are basically ADPase inhibitors. And so increase in myosin activity causes myosin binding to the actin molecule, and that ultimately stimulates the contraction in smooth muscle of vessels. So a quick recap. You have release of calcium via IP3. Intracellularly, calcium binds to calmodulin, which activate MLC kinase, and phosphorylates this myosin light chain, and that basically changes the head conformation of myosin head conformation, and basically stimulates the binding of myosin to the actin. And calcium and calmodulin complex along with MLC kinase activity phosphorylate and inhibit caldesmin and calponin, which are the ATPase inhibitors. As you can recall that ATP is required for hydrolysis of myosin head for the myosin to get ready for the next contraction cycle. So that's how contraction cycle occurs, and this is how you have contraction in smooth muscle of vessels. DAG, diacylglycerol, plus calcium, both of them, they activate protein kinase C, which phosphorylate CPI-17, and this is C kinase activated protein phosphatase. This is a phosphatase which gets, this is an enzyme that gets phosphorylated by protein kinase C, and that protein kinase C activation activates CPI-17, which inhibits myosin phosphatase. And as we can probably recall from the physiology lectures, that phosphatase is involved in relaxation of muscle cells. And when you inhibit myosin phosphatase via CPI, that is going to prevent relaxation and increase the contraction of smooth muscle. So that is how IP3 and DAG are stimulating the contraction of smooth muscle in vessels. So That was calcium dependent vasoconstriction. Now we're going to talk about calcium independent vasoconstriction of smooth muscle cells. Norepinephrine from sympathetic center stimulates G protein coupled receptor, and that is the RhoA. RhoA is a protein bound to GTP, and that gets activated upon the stimulation of norepi, and then that activates Rho kinase. This is a Rho kinase is a serine threonine protein kinase, and Rho kinase further phosphorylates and inhibits myosin phosphatase as well, and that increases smooth muscle cell contraction. Quick recap on that. Norepi stimulates the G protein, and Rho is coupled to the G protein, gets activated via GTP, and then that activated RhoA activates Rho kinase, and Rho kinase basically phosphorylates myosin phosphatase, and that myosin phosphatase gets inhibited, and you have smooth muscle cell contraction again. Another way the body conserves heat is by piloerection or epilation, and you have basically these are the hair standing. You have sympathetic stimulation of erector pili muscles attached to the these are the muscles attached to the hair follicles, and which cause them to contract and hair to stand. And this basically entraps warm body heat and air and prevents it from leaving the skin.